Hello, and welcome back to Preferred Medicare. I'm Holly Cohen, licensed independent broker. Today, we are diving into some major changes impacting Medicare and Medicare Advantage. These changes could affect your healthcare coverage. So it's essential to stay informed and stay close to the channel during these very changing times. Big changes in Medicare and Medicare Advantage. What you need to know. We're focusing on two important articles, one from Newsweek and another from Becker's Hospital Review. So let's start by breaking down the Newsweek article first. Hospitals across the country are beginning to exit Medicare Advantage networks, which is causing disruptions in coverage for millions of Medicare beneficiaries. Hospitals across the country are beginning to exit Medicare Advantage networks. Imagine having a preferred hospital or doctor that's suddenly no longer in network for your plan. This could disrupt your access to care and might result in higher out-of-pocket costs if you're on a PPO plan. If you're on an HMO plan, then you're completely out of luck. Many patients are left scrambling to find in-network care, often facing higher out-of-pocket costs. This can be especially challenging if you have ongoing treatments or specific healthcare needs. Here's what you need to do to mitigate these disruptions in your healthcare. Review your current network. Check if your current doctors and hospitals are still part of your Medicare Advantage plan. Understand your options. If they aren't, you might need to switch to a different Medicare Advantage plan during the annual enrollment in October, or even switch back to traditional Medicare. So to plan ahead, start looking at other providers now to avoid some last minute issues. The problem is that we are not in open enrollment at this time. So if you're on a Medicare Advantage plan and you have learned or are about to learn that your hospital is no longer in the network, then you're going to unfortunately have to switch doctors until you get through the end of the year. And then from October 15th through December 7th, you are allowed to change plans. Again, you can go back to traditional Medicare and try to enroll in a Medicare supplement, also known as Medigap plan, if you qualify based on your health. And you can enroll in a Medigap plan. Of course, those, if you've had Part B of Medicare for more than 6 months, you would have to go through a medical underwriting. And those plans will not, whether it's a new Medicare Advantage plan or going back to traditional Medicare, that would not begin until January 1st. Switch to a different doctor this time of year and wait it out until open enrollment when you can switch your Medicare plan or go back to traditional Medicare. Now let's take a look into Becker's Hospital Review article. The article titled 15 Health Systems, I said it right, 15 Health Systems are dropping Medicare Advantage in 2024. More details on this trend, Knudsen reports several major health systems are set to drop Medicare Advantage plans, impacting millions of enrollees. Several major health systems are set to drop Medicare Advantage plans. This means that a number of large health systems, hospitals, doctor networks are deciding to discontinue their participation in Medicare Advantage. This trend is part of a broader reevaluation by many healthcare providers. The decision by these health systems could lead to reduced access to care and increased costs for Medicare beneficiaries who are on a specific Medicare Advantage plan, but no longer can go to their local hospital because their local hospital is not accepting their Medicare Advantage plan anymore. This could really impact you in many ways. Reduced access to preferred providers. You might find that the health systems that you rely on are no longer available through your Medicare Advantage plan, if that's what you have. increased costs with fewer in-network options. You might face higher costs if you continue with your current plan. And again, only if you're on a PPO can you go out of network. If you have an HMO Medicare Advantage plan and your doctors or hospitals have left the network, then you are out of luck. You're not able to see those providers anymore on an HMO. And on a PPO, make sure if you're on a PPO to call your providers. And if they're out of network, you can still see them. It's just you're going to have higher bills when you do see them. If you're on traditional Medicare, this will not impact you whatsoever. If you currently have a Medigap plan, such as a Plan G or a Plan F or a Plan N, that means you're on original Medicare. And that means that none of this would bother you because there's no networks when you're on original Medicare. Remember this moving forward into October, when you can make a change if you're stuck on a Medicare Advantage plan, and if you have found that your hospital is no longer in network, you can switch back to traditional Medicare in October, on October 15th through December 7th. Going back to traditional Medicare would begin January 1st. And you can, during October 15th through December 7th, also enroll in a Medigap plan. Again, if you've had Part B of Medicare for more than 6 months, then you do have to answer the health underwriting questions and hopefully get approved for the plan. Otherwise, you're stuck on a Medicare Advantage plan, and then you would need to just call an agent, call an independent broker such as myself, and make sure that your doctors are in network for 2025. It's so important to stay informed and be prepared so that there are no surprises. Whether it's understanding your current plan's network, or exploring alternatives, or seeking professional advice by speaking to an independent broker or an agent, these steps will help you navigate this changing landscape of Medicare Advantage currently. If you found this video helpful, please give it a thumbs up and feel free to subscribe to the channel for more updates on Medicare, Medicare Advantage, and Medicare tips. Don't forget to hit that notification bell so that you never miss a video. I'm trying to keep you all posted. There are lots of changes this year heading into 2025. If you need assistance, please leave a comment below or reach out directly. Our phone number is 855-265-6334. Thank you for joining me today on Preferred Medicare. Staying informed is key to managing your Medicare effectively. This is Holly Cohen, licensed independent broker, and as always, please be well.